This is so frustrating. I have no leave because I took all of my leave when I originally got the surgery. And I know I'm going to have some time off. I mean, it's basically like another have to go, and basically the Seroma is a capsule, and the capsule is secreting fluid, the liquid, the fluid. And so they have to take it out or it's going to continue to do it. So I have an appointment tomorrow with her. She wants to talk face to face. My appointment is tomorrow at 8:30, so I'm going to have to let my boss know that I'm going to be coming to work late and I'll be in that. Like, I'm just ready to fucking heal. I look at other people and they don't have any of these issues, and I'm just ready to be done with all of this. I knew something was wrong. I knew because when I take my faja off, like it hurts in that area and it bulges out. So I don't know if it's deeper. The Seroma doesn't have that wave of fluid like it used to have. It's solid. I don't know how long I'm going to have to be out of work after this surgery. It's considered elective, so I don't know when they're going to do it because they're backed up with all of the other cases that were postponed because of Corona. So thank you to everybody that prayed for me. I really appreciate it. And tomorrow I will let you know what the doctor says. Hopefully she lets me record, but if not, then I'll just give you all an update. Well, on the right side, hopefully she can fix this dog ear that I have on my right side and give me a better looking scar. I mean, you gotta look at the positives through stuff like this. I'm just glad that I listened to my body, and that I didn't brush it off like, oh, you're tripping, you're fine, it'll go away with the massages. You have to listen to your body. So I just told my boss that I'm gonna have to have surgery again. I have an appointment tomorrow, so I'll be in late. And her response was, noted. No, I'm sorry to hear that. Nothing. No. And this is why I'm working hard to become an entrepreneur, because these companies don't give a fuck about you. They will replace you. I mean, point blank period. I literally tell her I'm having surgery and it's noted. Good morning, guys. So I'm on my way to my appointment. Again, I'll let you know if I can record or not. If not, then I'll just give you all an update when I leave my appointment. Alright guys, I am done with my appointment. I didn't get to get the whole conversation with my doctor. I just felt like it would be useful here. I did get a couple of snippets where she did show me my CT results, so I'll show you all that. Use a really good analogy to describe the Seroma. Basically, like an orange peel is the lining of the Seroma, and then the part that you eat is the fluid. So it's a really thick lining around. No amount of sclerosis, which was used to damage that lining, is going to work. It's too thick, so it has to be removed surgically. Now, guess when she said my surgery will be? The fall. The fall. So there's a backlog of patients that were canceled because of Corona, because this is considered elective. All of the elective surgeries were canceled. So I have to wait for all those people from March to have their surgery before I can. I'm gonna also hear her talking about knitting. So knitting is basically the type of technique that she's gonna use with the suturing. Basically keeping the skin down, knitting the skin down so that fluid doesn't accumulate. She also said that she can fix my dog ear when she does my surgery, and she can also do a scar revision, so my scar will be a lot thinner and lighter. So that's good. This is like a 5-year. I don't have this girdle on, this thing starts to protrude. And I'm like, what is that?
Yeah. Okay, well, I will, here's another view. This is looking at it face on.
So from the top down, from...
Like if you were to section your body this way.
Gotcha.
And look at it.
Okay.
Face on.
All that there. Okay. So is there anything that I can do to... No, because of that shell.
I wish.
It has to come out.
With the drain that Dr. Howard did, that's like pretty much what you can do. That's the least invasive thing to do.
Okay.
There's just, I don't think that there's any more role for attempted sclerosis.
Yeah.
I think that would just be unrealistic, wishful thinking. So I will talk to my friend and see what she thinks and how much she thinks she would charge, and I'll let you know.
Okay.
Okay.
All right, so 34 weeks down. I really want to get it done here. I really,
Yeah.
I paid so much because I had to pay over there.
I know.
Jeez. Okay, and you didn't see anything with my my muscle repair. My muscle repair was okay?
No, muscle repair is okay.
Okay.
Yeah, your muscles are nice and together.
Okay, because that's what I was afraid of. But you said that usually happens early on if that were to come apart.
Yeah. And it's usually, the patient can feel like a pop, pop, pop.
Oh.
The suture's coming out. Let's see. I'll tell you what to do. So these are your muscles here, actually.
Oh, yeah, okay.
And they're completely together.
So do you know exactly what causes it? Is it aggressive lipo? Well, no, because you said your patient didn't have that. So
yeah, I think my hypothesis would be that maybe the way the drains are in after the original surgery, maybe it just didn't collect fluid from that area.
Okay.
So the fluid was able to accumulate and sit there. Or when the drains come out, I don't know how long your drains are in initially. Usually it's 2-3 weeks.
Yeah, 2 weeks.
Yeah. Sometimes we think they're ready, but maybe a drain was clogged, and so it gave like a false reassurance that it was ready, and then we take it out, and then it accumulates then. I think there's like a 20% seroma rate after this. It's just to varying degrees as to how we manage them. Sometimes they're just little seroma you can suck out in clinic with a needle, it goes away, not a big deal. Or a drain goes away, not a big deal. Or, it progresses to what you have. So it's not a super rare complication, but you have sort of the more extreme version of it. I do know that folks that quilt during their abdominoplasties, you can lower the rate of seroma with that.
Okay.
So the quilting sutures I told you about that I ultimately did on that one lady, I think is how we finally got out of the woods.
Okay.
But not everybody does it as a standard thing from the get-go. And sometimes people think that you can actually compromise the blood supply to the overlying skin if you put too many sutures in it. So that would be one reason why somebody might not want to do that.
Okay.
Nice to meet you.
Nice to meet you too. Thank you so much.
You're welcome. And you have a really exciting new job. Life is in some ways not good for you, but in other ways really awesome and exciting.
Yeah.
I'll send you a secure message after I talk to my friend, and then I'll call you if it needs to be a longer conversation, okay?
Okay, sounds good.
All right. You have a good rest of your day.
Thank you, you too. Nice to meet you. So my doctor actually responded like 10 minutes after I left. I didn't realize that she messaged me, but she did come back with a quote. She said that her colleague will do it for $3,800. My tummy tuck lipo 360 BBL was $4,800. So here are my options. Pay $3,800 now, get it done now. Stay with my employer, get it done for my copay, which is $100. in the fall. That way I can get short-term disability, which pays for 60% of my income now. But then my new job will be like, okay, when are you starting? And I may miss that opportunity to work with them. So I don't know. The last option would be to wait until the fall to get it done. I'll be on my husband's insurance, and I'll still have the $100 copay, but I won't have the short-term disability because I won't be working for my current job. So what happens is when you're a W-2 versus a 1099, you get benefits. When you're a 1099, it means you're basically self-employed. You don't get any benefits, no 401k, no PTO, none of that. I don't have to pay for health insurance out of pocket because I'm going to be with my husband's. So that's a good thing. But this is too much. Like, now I just reached out to Dr. Medina. I told her what was going on. She's been in the loop since all of this started. She's been awesome. And I asked her if I could come back to her. And she said, of course you can come back here and I'll do the surgery for you. Now, it ain't gonna be free, honey. It's not gonna be free. But she did say that I would only have to pay, for the anesthesia. She would do her portion for free for me. However, she said that she likes for the capsule to get stronger. I guess it's easier to take out if the capsule is stronger. And she said about a year from now, I can get it done. Another reason she wants to wait a year is because she wants to allow for my body to heal completely from the first surgery. If she does it too soon, that increases the risk of necrosis, which is basically your skin dying. Now, keep in mind that this is basically me starting all over. I'm 3 months post-op right now. I've been in this damn faja for this whole entire time with my foams and my boards, and I'm gonna have to start over after the surgery. If you've been following my journey, you know how the beginning of all this, y'all know how I was looking. I was hunched over because you can't stand straight up because you might rip open your incision. So the back pain was excruciating. Like, I'm gonna have to figure something else out because I can't do that again. Oh, and my doctor here says she's not gonna only have to put in one drain. She's gonna have to put in 2 drains. Y'all know how much I hated that drain. Y'all know. So what do y'all think I should do? I don't know. I just want it to be over. How that song go? I just want it to be over. Sorry, I know I can't sing. But I legit want this to be over. I keep telling myself, this time next year, all this will be done. It'll be a distant memory. But if I have to wait another year to get the surgery done, then it's not.